This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hello, I'm Tyler Bates.
And I'm Christine Tenhoff.
And just give us a second here to try to pull up what I have. Okay, is this looking good here? Can you see our screen? Okay, thanks. So we are here talking about Providence St. Luke's Rehabilitation Medical Center residency program in the beautiful Spokane, Washington. So a little bit to get started to tell you about who we are. We are an advanced program with 6 residents a year, though we are working on opening it up as a categorical program. So keep an eye out. As you can understand, there's a lot of things that have to go into that one. So we're hoping that we can get there, but lots of moving places. And if not, there is a transitional year just across the street so that you can arrange to stay in the same place for all 4 years. And we are actually the largest freestanding rehab hospital in the Western US. We are licensed for 102 beds, though we've been having about 60 or so beds at this time, just due to staffing in the current situation. And we are CARF accredited for brain injury, spinal cord injury, stroke, amputee care for both adult and pediatric populations. And the brain injury unit is a specific brain injury locked unit with advanced telemonitoring systems for that. And we also do have a research program going on with quite an arsenal of publications.
Right. So as Tyler previously mentioned, we are the largest inpatient rehab facility in the Pacific Northwest. So that being said, we are a large catchment area within the US. We get patients from pretty much all over. We have patients from Oregon, across Washington State, Idaho, Montana, Alaska, even every once in a while from the Dakotas and Canada. So we see a wide variety of pathologies, and it's very interesting to interact with patients from all over the United States.
And a little bit further about us and some of the resources we have, because we do have such a wide variety and we are such a large institution. So number one that I think is absolutely amazing, we are attached to an imaging center. So when we need X-ray, CT, MRI, swallow studies, Doppler ultrasounds to rule out DVTs, we can just roll them down the hall to the local imaging center and things are done very seamlessly while they're still admitted. They don't have to take a ride anywhere. So that is amazing. We also have respiratory therapy in-house 24/7. We also have an in-house pharmacy. And then we've mentioned Sacred Heart Hospital is just across the street. They do all of our labs for us. And if we have any emergencies, they're just down the street. Very quick, easy pickup for any of our patients that need to go to a higher level of care. And the great thing is they are integrated. We're part of the same exact Providence St. Joseph health system using the same EMR, and that EMR is Epic. So it's great. We are able to track people as we know that they're coming. And if they unfortunately have to go to the main hospital, we're able to track that care.
So we have multiple rehab gyms throughout our facility. There's one large rehab gym on each floor. And then we also have a pool for pool therapy with a lift that's rated for patients greater than 500 pounds. We have multiple smaller inpatient gyms kind of sprinkled throughout, and ADL workspaces as well. We also have a cardiopulmonary gym with a Locomat and a zero gravity system or a zero G system. Something that's pretty unique about our location is we also have a driving simulator for patients that we're trying to decide if they are safe to drive upon discharge.
And this is one of my personal favorite things that we have. We call it the St. Luke's community. And it's all about focusing on getting people back to that community. As talked about, we have such a wide area and with limited health resources, honestly, in some of these areas. And so we have a community system where you can see there's a car, there's a truck, so people are able to practice transfers in and out of cars, trucks. There's an airplane body in case people are planning on going on a trip. There's basically a grocery store. Occupational therapy will take people there with a grocery list so that they can recreate shopping. And then, as you can see in the one picture, we have a full-size crosswalk so people can practice and see if they can make it across the crosswalk if they have any sort of anxiety about getting out into the community. We also have an independent living apartment, and then assistive technology labs. Basically anything to get people home. We've got great resources for, and then once they're home, we've got adaptive sports, snow and water ski programs. The water ski thing was just a couple weekends ago. I'm personally looking forward to the snow skiing program, and then we're nationally ranked for wheelchair basketball.
And there's plenty of opportunities for residents to volunteer. I didn't get a chance to volunteer for the water ski or ski day event that happened a couple Saturdays ago, but several of our residents went. They said they had a blast. It was fun to kind of see patients outside of the inpatient rehab setting, getting to know patients better.
And kind of the straight along follow on, we have what we call the terrain park as well. It's outdoors this time of year, and Spokane's amazing. But as you can see, a couple different ramps, steps of different distances, again, focusing on getting people out of there, and then different paving blocks. So really, really cool resources.
All right, so we've kind of told you about what we offer for patients, and I'm sure you guys are curious about what we offer as far as rotations and your educational experience while you're here. So this is currently our third year in the program, so a lot of these rotations are still kind of in the works, but this is what we have set up so far. So your PGY 2 year is going to be mainly all of your inpatient rotations. We have one rotation spot where you do 1 to 2 months of general outpatient, which is located at the St. Luke's Rehab. There's an outpatient office where we see follow-ups. So you'll have an opportunity to do that. You'll have an opportunity to rotate through the spinal cord injury, brain injury, and amputee teams, and then neural rehab as well as general rehab. Then your PGY 3 and PGY 4 years are going to be more of your outpatient rotations. So very similar to a lot of other programs. One thing that's interesting about our program is we have a contract with Swedish Hospital in Seattle for our pain management. So this is a very popular rotation for our PGY 3s. They try to get that rotation earlier in the year if they're interested in pain management. We also offer different outpatient rotations for those of you interested in spine as well. We have lots of opportunities for neuromuscular experiences outpatient with stroke and EMG clinics. We have our ALS clinic, which is pretty unique. And then PGY 4 years, when you'll be available to do consults, you'll get more pediatric rehab. You'll get another opportunity to come back and do a month of inpatient rehab when you're 4th year. There's opportunities for research as well as possibly getting to go to a remote location and acting as an attending in an inpatient rehab role.
Yep. And what we're hearing from the PGY 4s is most of them have about 200 EMGs at this point going into PGY 4. So definitely no lack of exposure along EMG side. Call is another thing that I'm sure you have questions about. We are doing basically overnight call equates to about a 24-hour day. Christine's actually on the inaugural call tonight. PGY 2-year is the most calls, but it's still only about 3 to 4 times a month. That does include the holidays and more heavily on the weekends. But as a PGY 3, you might be on 1 to 2 times, and PGY 4 maybe once a month. On-call attending is always available. The on-call team is the one that does the rounding on the weekend. So if you're not the one on call, you're not coming in doing rounding. As we already said, Sacred Heart's just down the street. And you can see pictures. The call room's not too shabby as far as call rooms go. And since you're doing the 24 hours, there is a post-call day the following day. Yeah. And I just included these couple pictures here. The waterfall one, the larger one, is right outside the dining area. Even if there's not much time for lunch, I like having a couple minutes to soak up the vitamin D. And then the other one's this little stream, which again, on my thing that I've emphasized of getting people to the community is I hear rumors that rec therapy or PT will take people out to the stream to practice fishing. Of course, there's no fish in that stream, but it helps build the confidence that they'll be able to, with their injury, participate in activities that they enjoy doing.
All right. And then as far as benefits that residents receive as being part of this program, so this is our updated salary for the current year. Again, this will kind of be adjusted by the time you guys become PGY2s based on inflation and other things. We offer 3 one-week blocks for vacation and try to schedule those early on. There's also 5 individual days that you can schedule throughout the year as you need them. You get 3 half days per year for personal wellness days. Good opportunity to just take some time off if you need to go to a dentist appointment or things like that. And then we also offer residents 5 days of CME days per year that you could use for conferences and things like that. We have a pretty decent cafeteria here, and we offer $3,000 of food stipends per year per resident. Parking is plentiful. It's free for residents. You'll get a parking pass. There's a few different lots that residents are available to park in. It's generally pretty safe. If you're leaving here late at night, we have security available. They can escort you, but it's a generally safe neighborhood. In the workroom, I don't know if you can kind of see behind us, we offer dual monitors. We also have a window in our workroom. So that's kind of nice to see what's going on outside. With our program, you work directly one-on-one with attendings, which is really nice to have that one-on-one time. It's great for education. Our attendings love to teach. We also offer residents an $1,000 a year or $1,000 education stipend for the 3 years. So you can use that for things like board study materials, textbooks. And then there are residencies at Sacred Heart that are nearby. So Family Med, IM, Psych, and Peds. So sometimes those residents can be good resources. We also offer 3 different health insurance plans available when you come on based on your personal needs. Sorry about that. And 401k 50% match for the first 3%.
And we know we're coming up kind of closer to time, so feel free to put any sort of questions you have in the chat. We'll monitor that as we roll in. Didactics, Friday morning is typically attending run didactics. It is 100% protected time, and they are very adamant about it, that it is protected time for us. Right now, we're going through our PGY2 boot camp. It's separate. It's just us PGY2s learning what we need to know for rehab, and eventually we will be joining the 3s and 4s. It's on an 18-month rotating schedule. And then we also additionally have resident-led Medicine Mondays and PM&R Tuesdays that are a resident thing over lunchtime. Make sure that we get plenty of skill sessions, journal clubs are held, and as mentioned, scholarly activity exists. This is our current batch of residents. A handful are applying, of the senior class are applying for fellowship. The other handful are applying and getting many job interviews going in. One's even doing like medically complex. So they very clearly feel prepared to be able to enter the workforce. Some names, we'll make sure that PM&R Scholars has the access to this. Here's some of our faculty. We have faculty boarded in all sorts of different specialties. And wellness. Wellness is a point that we are working on getting at a little bit better. It's an unfortunate thing with a new program in the middle of a pandemic, but we do have access to resources not only as residents, but as employees of Providence, which includes like a local gym membership for $29 a month, no contract, no pre-fees, access to yoga and meditation apps, mental health resources. As Christine mentioned, those 3 mental health half days. And then, as I said, we're working on getting wellness days and retreats up and running. Here's a picture from a recent baseball game that we did. Attendings are starting to take turns hosting barbecues. So really kind of working on getting back into the flow afterwards.
5 minutes.
5 minutes. Awesome. Is there anything we should address question-wise on there?
Just kind of going through. Do you know anything more about the sports coverage? I know there's been some talks of getting opportunities for like high school sports coverage.
Yeah, I don't think it's been set up yet. I know it's something that's
The
interest has
PGY3s
been
are,
expressed.
yeah. PGY3s are definitely been working on that. So I would imagine within the next year, we'll have something established.
And they're reporting amazing things out of a newer rotation they have set up, which is essentially like sports med, very ultrasound heavy, stuff like that. Let me tell you a little bit about Spokane. Feel free to keep the questions coming here. Spokane's an amazing city. It's basically the Pacific Northwest, but with sunshine. That's what I'm going to go with here. We have so many different annual events, parks. There's a junior hockey team, minor league baseball, and there's a new soccer league coming in. Plenty of farmers markets, outdoor activities, food, definitely food, coffee, breweries, you name it. We definitely have options. And here's my personal thing to talk about. We got biking, hiking, camping, skiing, anything outdoors. The one of the bike path is the Centennial Trail. It links Spokane, Washington, all the way up with Coeur d'Alene, Idaho. It's over 40 miles in between them, paved path. I actually took that 2 weekends ago just to make sure that we could say how awesome the outdoor stuff is. Down there, that's one of our local ski hills. I did not take that picture because it hasn't been winter yet, but definitely looking forward to that. So if you love doing outdoor things, we've got it available. So really, please consider joining us. Fantastic rehab education in a beautiful location. Here's our contact stuff while we work on answering questions. Stuff like, if you have any further questions though, please reach out to our program coordinator, Samantha, or any of them, and we can drop our stuff in the chat, but we can cover the questions here if we have any. Thanks. Yeah, as far as like USMLE and test scores and international rotations, please reach out to our coordinator. As PGY2s, we don't know the ins and outs of that. Sorry, we can't answer that well.
I will say in general, PM&R as a specialty is very holistic. And I think pretty much anywhere you go, you're going to find kind of a similar answer, that it's not focused solely on test scores. Well, that's important to kind of gauge your overall academic readiness. I think, you know, if you have other things on your CV that kind of make you stand out, we definitely do take that into consideration. Our program director definitely takes that into consideration. Our program director is awesome. Yeah, Dr. Carter is amazing. Any other questions that you guys have? We'll both drop our emails in the chat for you.
Didactics are not broadcast virtually. That is a good idea. That's definitely something that we can bring up to our faculty. Three new message. And yeah, please feel free to send us emails. The rehab being done here is absolutely amazing. We're getting people back doing the things that they want to do. And in the meantime, you can be outside doing the things that you want to do. Food around this place is delicious. $3,000 of food is pretty awesome. And I think Joshua is going to be kicking us off right now, huh?
Yes, thank you very much, Tyler. And I'm sorry, remember your name?
Christine.
Christine, thank you both of you. Thank you very much. We'll
Thank
go
you.
ahead and switch over to our next program.